Pavel Wapniarski recently sued you successfully for malpractice.
That was settled out of court.
Nonetheless, there's an appearance of motive, or at least a conflict of interest. Add in the fact that you had left the hospital the day in question, depriving you of an alibi, plus a witness who places you at or near the felony itself. Reputationally, this hospital can't afford to have our doctors be seen as carrying vendettas for retribution. So we need to ask you, Dr. Ripley, directly. Were you or were you not responsible for what happened?
I have no comment.
Dr. Ripley, you do understand that if you don't cooperate with this committee, you could face indefinite suspension?
I do.
Hey,
I thought we agreed you were
making
gonna
a
cook dinner.
YouTube video,
Changed
Dad.
my mind.
You changed your mind, great. Just like that, because now you've been suspended. What happened? Did Sully tell you not to say anything?
No. He told me his cancer was terminal.
What?
Yeah, his latest PET scan confirmed it. He might only have a few weeks left.
Reg, I'm so sorry.
How was I supposed to tell him that I was being forced to snitch on him? That he was gonna have to spend the remaining days of his life caught up in arraignments and bail hearings away from Lynn and his kid.
But none of this changes the fact, though, Reg, that your career's on the line.
Stop. Okay? None of it matters anymore.
But you're not practicing medicine. Does it change?
I won't put him through that.
Any improvement?
Her EEGs are really acidotic. Looks like she'll need dialysis.
Her kidneys are failing?
Not yet, but they're trending in that direction.
Dr. Archer, I know this might seem completely irrelevant, but Dr. Lennox has a patient in T5. His name's Tyler.
Dr. Lennox is perfectly capable of taking care of her own patients, at least I hope so.
No, I agree, sir, but in this case, anyway, her patient is showing some fairly inconsistent symptoms himself. I mean, at one point we thought he might have bird flu, but...
Alright, you can't tell me what any of that has to do with Cadet Herrera here?
Tyler's kidneys are also failing. Maybe you and Dr. Lennox should compare notes.
Yeah, I'm not seeing it. I mean, yes, they both have a metabolic acidosis, but that's not that uncommon.
Well, did your patient present with anything that is uncommon?
Her tongue, right?
Her tongue?
Yeah, it swelled up pretty quickly after intake. Sores, lesions suggest that she must have ingested something.
Huh.
Yeah. Your patient's not demonstrating any of that, right?
No.
What about the cut on his hand?
The cut?
Tyler cut himself harvesting sunflowers.
But you mentioned it looked like he'd been burned the way it's scarred up.
Could just be a reaction to something he was growing.
You said he was a farmer, right?
Yeah, sunflowers and hemp.
My patient's B3 levels were high when she came in. And her commanding officer said something about her being tested for drugs this morning.
Maybe she was trying to rig the test. Tyler's mother mentioned that they were up here buying a new pickup. They came into some money recently. I'm sorry, what are you talking about? On your farm, Tyler? Are you growing pot?
My boy wouldn't do anything like
All right,
that.
there's a young woman who may die over there unless we get an honest answer out of you.
Tyler, is this what's going on?
I started growing marijuana on the back acreage, yeah. But only to keep the farm going, Mama.
Tyler.
Have you been using any pesticides?
Yeah, a little. But only to increase the yield.
Paraquat. Any chance you may have sold any on the IW campus? All right, we need to up
Let's
the
do a quick
firepower on
bedside
Herrera.
rate to confirm. Mix 10
chemo
milliliters
maybe.
urine with 1 gram of sodium
Cyclophosphamide,
bicarbonate and 1
plus
gram of
amp up
sodium
the
dicarbonate.
immunosuppressants.
Okay, got it.
Why my parents lied to me? Why did they lie? You know, if I had to take a guess, it's because they were motivated by their love for you, Max, and their desire to spend as much time with you as possible. If I were them, I might be doing the same exact thing.
What's going on here?
Max, are you okay?
No, I'm not okay. You promised me I was gonna play soccer again.
What did you just do?
I told you, that as a pediatrician, I am obligated to advocate for my patients.
Can I speak with you outside, please?
Daryl, get over here.
Don't you ever talk to my son again.
Are you okay?
Come on. Fine.
Take this man into custody.
No, hey. You can be. We're fine here.
Dr. Asher, Campbell's waiting in Peas versus Otto. 22 weeks pregnant. You're going to trauma 1.
Head trauma, patient unresponsive. GCS 3, BP 202/95, heart rate 52. Kendall?
Lose it for a moment, but she crawled, so we intubated her.
Okay.
Gentlemen, right here. Sir, I'm going to need you to stay right there, please. Right there.
Okay, on my count. 1, 2, 3.
Thank you, Courtney. Thank you, Matt.
If you have more setting epidemic trauma, pressure for brain herniation.
Call CT to look in neurosurgery, Dr. Stat.
You got it.
It all happened so fast. 1 second, we're walking out from the market, and the next she's screaming, and I don't know who, insisting they're trying to get her, and then she just bolted out into traffic.
Okay, we're gonna do what we can, Bryce.
Both scanners have patients on the table. CT 250 in 10 minutes. Neurosurgery can meet you in the OR in 20.
Wait, she doesn't have time for that. No, we need to leave the session now. Okay, give me an eye, okay? We're gonna take the 50mm intraosseous needle to aspirate the blood.
You okay?
When's the last time you did one of those?
How much of your own medical stage? We don't have any other options yet. I was brain.
Couple.
Where's that girl?
What are you doing with that, sir? Let's get this patient to CT.
If you're 50 or over,
NBC and Peacock.
I checked Kendall's call history. You were right. He wasn't talking to anyone. At least not on the phone. I don't know why. I was so afraid to look.
Mr. Lane, the good news is Kendall's been stabilized for now and your baby's still viable. However, your wife sustained significant head trauma. She's not otherwise yet. The next 24 to 48 hours will be crucial.
I suspected she was showing signs of distress. I did. What was I supposed to do? She wanted a baby. She wanted a baby badly.
Bryce, it's the trickiest part, right? I mean, it's so confusing. Of course we want to respect our loved ones' sense of autonomy, right? And a vast majority of the time, you're able to do that. But sometimes we gotta step in and protect people from themselves.